having. Now, I looked a bit through your chart and I wasn't really clear. I see that you've had some prescriptions in the past for Tylenol 3, a sprained ankle at one point, and so on over the years, yes. And it looks to me like those are being used pretty responsibly, but I am seeing that in the last few months there have been more of these prescriptions than normal. Now, you have said things are more stressful. Have you noticed that you're using more than normal, and do you have any concerns about that?
No, not at all. I think that, as I said, these medications are really helpful to me. They help me just to get through the day and to be a better mom for my son. We're going through a lot right now. But no, I'm not worried at all. I just need my refill today, and then if I can get that, that would be great.
Well, let's talk about that, because in order to prescribe any medication, and I don't doubt that you're a responsible person and doing your best to manage as well as possible given the situation, which does sound stressful, I do need to be clear about a few things. Now, one of the things I do with my own patients, always when prescribing medications that have the potential for addiction. Now, are you aware that Tylenol 3 contains codeine, which is potentially addictive?
That's not what's going on here, Dr. Rose. You don't need to worry about that. Like I said, I am very responsible. I just need these meds for my neck pain and for my stress.
And to be clear, I'm not accusing you of anything at all. Right? Okay. This is not what I'm saying. But when people are using more than their prescription is originally intended for, we need to look at maybe the underlying causes of that and what might go on, and do we need to approach things differently. So one of the things I do with all my patients is I ask them about if they're using any other substances, not prescribed substances, but any other substances to help them cope. For example, do you drink any alcohol?
Not at all.
Not at all. Okay. Smoke any marijuana, anything like that? Cocaine is sometimes used. No. Okay. No, people use various things. No street drugs or anything.
Absolutely not, Dr. Rose.
Good. I'm glad to hear it. Do you receive any other prescriptions to help with your mood, to help with anxiety or anything like that? I don't see anything on your file here.
No, I only see Dr. Barr. I'm not on any other medications.
Do you take any over-the-counter sleeping pills or anything like that you can buy in the pharmacy, like Night Ease and that sort of thing?
I had tried those once before, but I didn't really find that they worked, and so no, I'm not for years.
Okay, fair enough. Now, you've mentioned some of the neck pain and that sort of thing. Have you tried Tylenol, extra strength Tylenol, ibuprofen, anything like that?
They just don't work for me. I have, but honestly, I might as well just be taking a sugar pill. Those things, they don't take care of the pain. It's really bad. Sometimes I just can't even function.
Okay. What other ways do you have of dealing with pain or when things are stressful? Are there other ways besides medications that help you cope with things?
I mean, sometimes I'll phone my girlfriends and we'll talk about what's going on, but I'm really busy, so
okay.
I don't have a lot of time to be, flittering about chatting to my friends. I need something that's going to manage my pain so that I can get on with my day.
Fair enough. Now, you said you don't drink alcohol at all. Why not?
Well, I don't.
Okay. Have you ever drunk alcohol?
Yeah, I mean, well, who hasn't? Yeah, absolutely. And when I was younger, I did, yes.
Did you? Okay. Have you ever had a problem with alcohol or any other substances in the past?
No, a problem? No, I haven't had a problem.
Okay. What would you say is the most alcohol, what was the period in your life where or I should say, was there a period in your life where you were drinking regularly?
Yeah, everybody was. I mean, back in college, everybody was drinking. So for sure I drank then.
Yeah, lots of drinking goes on then, for sure. What would you say was, when you were drinking the most, were you drinking every day?
Yeah, there was always a reason to celebrate. Yes, I drank more days than I didn't.
Okay, fair enough. And on those days that you were drinking, what would be your average intake in number of say, what would you drink normally? Beer? Was it mixed drinks, coolers, what sort of thing?
Usually mixed drinks like vodka crans or vodka sodas.
Mhm.
I
Okay.
mean, yeah, I mean, depending on the night, on the weekends, I probably lost count how many drinks I had. Those were big party years for me.
And did you suffer from hangovers frequently?
Oh yeah, yeah.
Did you ever need a drink in the morning to kind of get you going?
Oh my gosh, no.
Okay. Did you ever feel that you were drinking too much and you needed to cut down?
No, everybody was having a good time, so
Okay.
no.
Yeah, it is, at college, can be a party atmosphere and people will drink a lot. Use of any other substances at that time? Marijuana, cocaine, speed, anything like that?
No, definitely not speed or cocaine. I mean, once in a while somebody would have a joint, but I didn't really like that. It
Okay.
wasn't fun for me.
Sure, fair enough. Now, did anyone ever mention to you about, say to you that they had concerns about your drinking?
Well, my boyfriend, I mean, now he's my husband.
Mhm.
Yeah, my boyfriend was concerned. He would say sometimes that I took it too far.
And how did you feel about that?
Oh, it made me upset. I mean, couldn't you see like we were all just having fun? That's what everybody was doing. It made me angry, but I know that he loves me. And I know that he wants what's best for me. So,
Okay.
yeah.
And so you're not drinking now. When did that change happen and how did it happen?
Well, when we were looking at getting married, to be honest, it was kind of him or my lifestyle at the time, and him or the clubs, and I love him. He means the world to me, so I made my choice.